Hey, welcome to the program. Good to have you along with us here on Coastal Daybreak on the Talk Station and with Sugar Talk with Dr. K. Jean Lucas from Diabetes and Endocrinology Consultants. I'm glad you were able to swim in here this morning, Doctor. How are you?
Yes, I'm great,
Good.
thanks.
What are we talking about today?
We're talking about diabetes and cancer,
Uh-huh.
which is sort of an odd topic, and most people don't think about that. They think about diabetes causing, heart disease and strokes and heart attacks and all that,
Kidney issues and all that stuff.
but not really cancer. And it's sort of interesting why it's associated. Some cancers are increased in people that are overweight and people with diabetes. So they're not sure why that is. They think maybe if you are insulin resistant, then you make a lot of insulin. And insulin's a growth factor. And growth factors tend to cause things to grow, of course, and tumors can grow. However, that doesn't explain why the cancer starts in the first place, because cancer is a genetic defect in a cell that makes it just grow like crazy and not care what anybody else thinks. It's just growing. Most cells are controlled. They don't grow all the time. They don't produce new cells.
Right.
Unless there's a high turnover of cells, like on your skin. You produce a lot of skin cells, or in your mouth. So most cells are not turning over all the time. But cancer cells, the control over their growth is damaged genetically, and they're different. So that's odd that you'd have diabetes or obesity would do something genetically to the cells.
But there may or may not be a causal link. They just may happen to operate parallel to each other. I mean, because a person has cancer, their diabetes is also feeding it, essentially.
It could be that the insulin-resistant people tend to grow if they have a cancer cell, and the cancer cells cannot be controlled by the immune system, because a lot of times a lot of genetic defects occur and the immune system just gobbles them up and they don't ever grow. But if you have high insulin levels, you may cause things to grow more, and that's possible. The other possibility is that the fat cells in the abdomen make estrone, which is an estrogen that's sort of bad. That can cause endometrial cancer. And endometrial cancer is the one that's always touted as the most increased if you're overweight or you have diabetes. And that's an estrogen-related tumor. So the fat cells in the abdomen make estrone. That doesn't mean that, and then also breast cancer is more common in people that are overweight and people that have diabetes. But you have to look at the incidence of breast cancer. I mean, if it's a 50% increase and 12% of people get it, then 50% might be 18%.
Right.
It's not like huge. And endometrial cancer is 2.8% of the population. So if you increase it by 50%, which diabetes does,
You're up to 4.
Yeah, it's only 4%. So it's still not real common cancer. Pancreatic cancer is more common in diabetes, but the incidence of pancreatic cancer is 1.5%. So if you increase it by 50%, you're only going up to 2%. So it's still a very unlikely cancer, and endometrial cancer is rare too. So all these cancers are rare. It just looks bad if you increase something by 50%, but I think people need to keep that in perspective.
But still, I mean, are there studies that are ongoing about any relationship between diabetes and cancer?
Yeah, they're looking at what the fat cells make. Do the fat cells make some chemical, the abdominal fat cells? If you have too many of them, do they make more chemicals, inflammatory cells, inflammatory growth factors that do something? But I think it's more of a growth thing rather than a genetic damage. You also, so that's mainly it. I think it's mainly the fat cells making some kind of abnormal growth factors, making estrogen, can increase the risk of some cancers.
Is there any kind of relationship between the medicines and the cancer?
Well, everybody thinks that because of the lawyer ads. So
because
that's what
45 seconds of the 60-second ad is and then in disclaimers.
Well, there's always the ads for that, and diabetes drugs have been accused of causing all kinds of things. The very first one was accused of causing heart attacks, so people stopped using oral agents for a long time because of that. And now, since the cancer incidence is increased with diabetes and obesity, and more people are becoming overweight, then you have an increased risk of all those cancers in general. So it's hard to say that a drug that you only take for 6 months causes a cancer, because cancers develop over a long period of time. sometimes up to 10 years it takes to actually detect them because they start out very small and gradually grow over time.
Mm-hmm.
So it's hard to say that a medication for diabetes would be the cause of it. Metformin, on the other hand, appears that you have a decreased risk of cancer with metformin, which is surprising to a lot of people that metformin does that. Like a drug actually decreases your risk, but probably because it treats insulin resistance. And if you lower the insulin levels in your body with the metformin, then you're less likely to get cancer because insulin causes cancer to grow. Endogenous insulin that you make on your own.
All right. So again, there may not be a causal relationship, but it's one that if you can inhibit it, it would be good.
Yes. So I think the reason we're bringing this up is that cancer and heart disease can be prevented by losing weight and stopping smoking. Smoking is a big one that causes lots of kinds of cancer, since tobacco contains a lot of radioactive materials that most people don't realize. It's not the nicotine that causes cancer, but it's all the other stuff that you get when you inhale all that stuff into your lungs. So it's radioactive materials that cause different kinds of cancers. But there was a scare about Actos causing bladder cancer. That's been subsequently disproven. There was a problem with Farxiga, that a couple of people had bladder cancer in the studies, but it wasn't significant, but it got the lawyer ads going. That was found not to be true. Byetta, Victoza were causing problems with rats, with thyroid cancer. That was not proven in people, but everybody focuses on the rats. Well, the rats' thyroid is different than people. It's sort of unusual to say that, but the rats are different.
Rats are different than people. Oh, wow.
And it turns out that their thyroid has more receptors for these drugs. So if their thyroid is different, it has more receptors, then the drugs are going to cause things to develop in them, and they wouldn't do it in people. The other one is there was an insulin study, taking insulin shots. Does that cause cancer? And they were worried about that because if your own insulin can stimulate cancer to grow, could a shot that you're given? And so people go, oh, good, I don't have to take shots. But that was disproven also.
Okay. Coming back in just a moment, going to remind you about Diabetes School that's coming up as well. Hey, welcome back here on Coastal Daybreak on the talk station FM 107 and AM 1240 with Dr. Kay Jean Lucas from Diabetes and Endocrinology, who bring you Sugar Talk every Monday morning. And we're talking about a connection, or if there is one, between cancer and diabetes. And as you said, I think the key here is that you're asking people to lose weight because there's so many things that are associated with that.
Yes, and preventing cancer is pretty easy. If you think about it, you can't prevent what you've inherited, and you can't prevent your genetic tendency, but you can certainly prevent the other things like the smoking and the overeating and the increased abdominal fat. Exercise decreases risk of cancer. So all these things help with your weight, and your weight is very associated to getting cancer later.
Okay.